Remedios Luna Francisco immigrated to the United States in the 90s. She was a trained math teacher in the Philippines, working in elementary school education for decades before immigrating. She left 7 children and 15 grandchildren in the Philippines to work abroad to support her family. Remedios was my grandmother, my nanay. I watched her take care of 6 elderly people when I immigrated to the US as a child. Here, she's standing in front of the small room attached to the care home's kitchen that served as her bedroom. It was eventually my bedroom too when we moved in with her. Over the kitchen table, in kwentuhan, talking story among other Filipino immigrants, she learned how to cook American meals, figured out how to address the health needs of the people she cared for, lifted them up from the dinner table, helped them to sleep, and created a warm home for them. They loved her for it. I also saw her work take a toll on her body. Without health care, it was the caregivers in our community that referred her to a free clinic when she needed therapy for back pain. She'd end some days on a contraption hooked onto a door that stretched her spine. She was tired, but she taught me about the community she needed to survive. Today, caregivers like Remedios, Filipina and Filipino immigrants are still working as hard as she did to care and assist for the elderly, people with developmental disabilities, those who are chronically ill, those who need help in their day-to-day. Because caregivers work in non-hospital settings such as nursing homes and assisted living facilities, they often face the issues of their daily work alone. During the COVID-19 pandemic, their plight was even more isolating, and they were largely invisible as they cared for those most vulnerable to the virus, those who are 65 years old with pre-existing conditions. As their workplaces became hotspots for COVID-19 transmission, caregivers were left out of the conversation about who was considered essential workers on the front lines, who was considered necessary to protect with the right equipment and work conditions. Recent studies have shown that the Filipino community in the US have suffered disproportionately from COVID-19 deaths compared to other Asian American groups. The uneven impact of the pandemic in the Filipino community might be attributed to the number of Filipinos working in the health field on multiple front lines. If Filipino nurses make up a third of deaths from COVID-19, while they are only 4% of the nursing population nationwide, what about caregivers? Filipinos are a formidable population as direct care staff and caregivers, yet this type of care isn't often valued equally as other institutions in the healthcare system. Faced with a global pandemic, the paradox of Filipino caregivers were that they were invisible and essential. They were needed, yet they lacked the personal protective equipment and information about the virus they were confronting. With the strict COVID-19 protocols, caregivers' community, the conversations among one another at church or at the local Filipino market, their kwentuhan disappeared. Kwentuhan is a cultural Filipino practice of talk story, where exchanges of experiences, banter, and of course essential information happens. The kind of talk story that happened over my nanay's kitchen table. She taught me that kwentuhan not only builds relationships, it sustains them too. Through the pandemic, it was the creativity of Filipino organizations like Filipino Association of Workers and Immigrants, or PAWIS, that brought back a sense of community. Through virtual kwentuhan and monthly events organized by caregivers, we use this practice as a research method to explore the experiences of caregivers under COVID. We discovered that they felt scared, isolated, and alone. They needed PPE and information about COVID-19. And most importantly, they needed each other. Armed with what we knew from kwentuhan, PAWIS organized PPE drives to distribute needed equipment to caregivers. When the restrictions started to loosen, outdoor drives were organized and house drop-offs became one way to address the practical and community needs of Filipino caregivers. Care packages included PPE and banana bread, necessary sanitation equipment, and conversation. During the COVID-19 pandemic, when caregivers' lives were at such high risk And in the absence of structural support for care workers, PAWI's worker leaders, community members used Kwentuhan to identify the needs of their community and came up with safe ways to provide it. In one way, these organizing campaigns provided necessary equipment for Filipino caregivers. In another, it built visibility for a community of essential care workers, for one another, and to the broader public.
Most of the employers do not provide PPEs. So, pandemic or no pandemic, they need the PPEs. Especially right now, it's they're essential workers, they're frontliners. They need the PPE so that they won't get infected of the COVID. They're so vulnerable. Caregivers are so vulnerable to contracting the COVID because they're first-hand frontliners.
When the care industry supports failed, many Filipino migrants turned to Kwentuhan and community members to rally together to meet their needs.
Because PAWI, this organization helps me a lot, and not only helps me, but also to the other people that they doesn't know their rights. Because PAWI, they bring and they educate the people.
Like my nanay taught me, caregivers show us that they use the tools available to them, Kwentuhan, their networks, to care for one another. And as a scholar activist, I see my nanay in them, across the kitchen table, in a Zoom room, on a PPE drive. When scholars, students, activists, children of immigrants, grandchildren of caregivers collaborate and organize with workers to advocate for safe and dignified workplaces, we can see the power of their stories, the power of Kwentuhan. May we remember the power of their stories. May we remember the power of our work together. May we remember that we have power and together we can make change.